Word. Um, so my name is Kari Kientzy. I'm one of the APS section managers here in San Francisco. And I've been invited today to talk a little bit about elder independent adult abuse and kind of an overview of adult protective services in San Francisco. So today I'm going to kind of walk through or kind of some of you might have been to a mandated reporter training before. It's a little bit of that, and I tailored a little bit more for this audience. And then at the end, we'll be a little bit more about some data, trends, case examples, et cetera, but kind of tailored to APS in San Francisco. Okay, oopsie. Sorry, always I just get that first slide. Okay, so for those of you who don't know, adult protective services, we really get our kind of power, kind of how we were started, our guidelines for running our program and kind of what we investigate, et cetera, comes from the California Welfare and Institutions Code. That's where we get our legal framework that really drives the work that we do. And the interventions that we put in place for the clients that we get referred. Part of that requirement is that in California, all APSs operate 24/7, so you can call us any time of day, any day of the year, and there'll be somebody there to take a report and to receive and respond to reports of abuse. And really kind of in the Welfare and Institution Code, they give kind of this theoretical framework for us to have four main goals. One is our primary roles is to investigate allegations of abuse, neglect, exploitation, and self-neglect in older adults and people with disabilities. You'll hear me talk a lot about this today in the presentation of wearing our investigator hat. We also need to go out to serve the clients when we get these referrals about people kind of that might be in harm's way. Our goal is to focus on safety, protection, and really harm reduction. We know that we serve adults and they have rights. And so really our goal is to kind of focus on how can we mitigate these allegations of abuse and really kind of get in, hopefully put some supports in place and kind of pass the baton to some other community supports to keep them safe and kind of engaged in services long-term so they won't be reported back to us. We also, as I mentioned, do work with adults. And so really self-determination and putting in the least restrictive intervention possible is kind of our guiding principles and goals. I know sometimes people are fearful for reporting to the city and county or kind of any government agency saying, if I report to them, they might put my loved one in a nursing home or remove them from their home, et cetera. We always like to highlight that really our goal is the least restrictive intervention to keep the person that we're serving safe and out of harm's way. The last thing that we really want to highlight when we do these community outreach events is that confidentiality is key. When we receive reports of abuse, we aren't able to share with others except under very strict circumstances, generally by subpoena, who our referring party is. So, when you are calling Adult Protective Services to make a report of abuse, that, your name won't be shared with the person or others working on the case, because we really hold that to a high standard, because we want you guys, if you maybe do have a personal relationship with that someone, to hold that personal relationship where we can investigate your allegations or concerns. So I'd like to take a second to kind of talk about, I might use some terms to make sure we all have a shared understanding of what the definitions are. So the first thing that I like to say that's outlined in our Welfare and Institution Code is elder. So for Adult Protective Services, it's any person residing in California who is 60 years of age or older. Some of you may not have attended a mandated reporter training or a training on APS in the last couple of years and might notice that this age decreased. We used to only consider elders 65 and older, but there was a change in starting in January 1st, 2022, that actually redefined what's considered an elder and decreased our age down to 60 to be more inclusive of people we really are focusing on intervening earlier in people's lives. So therefore, we can hopefully intervene to lessen the harm versus maybe waiting too long to intervene to assist someone. So with that thought process in mind, Assembly Bill 135 was put into place and passed to really reduce our age restriction for elders down to 60 to open up our services to more people. I also have kind of elder abuse and caretaker on here, just so we know that elder abuse is the act of omission or commission by a person who stands in a trust relationship that results in harm or threatened harm to the health and or welfare of an older adult. So I say this to say some people commit elder abuse. Oops, sorry, my mouse is very finicky today. Some people can commit elder abuse, but they don't mean to, right? But this is one of those things that we say sometimes, you can neglect somebody not out of, ill will, etc. But that still means if you're not caring for somebody, you're not taking the steps that a reasonable person would in the same situation, that's considered elder abuse. A caretaker is any person who has the care, custody, or control, or stands in a position of trust with an elder or dependent adult, whether it's paid or unpaid. And I also like to highlight the dependent adult definition as well. It's somebody who is 18 to 59, and they can be physically, mentally, or emotionally disabled and relies on others for ADL or IADL support. For those of you who we speak in acronyms in social work sometimes. So ADL stands for activities of daily living. IADL stands for instrumental activities of daily living. So really you rely on somebody to kind of complete your daily functions. And this includes functional limitations as a result of a mental or physical disability. And a disability can also be temporary. So kind of our jurisdiction also includes people who are in the hospital, because if you're hospitalized, you fall under temporarily disabled provision. And I'm not following the chat, so if there are questions for me, feel free to Juko-san, interrupt me, and I'm happy to field the questions as they come in. So kind of what is elder abuse? What kind of types of elder abuse are should be reported? So under the California Welfare and Institution Codes, it outlines these types of abuse, which are the ones that we are, investigate. They include physical abuse, sexual abuse, abandonment, kind of being a caretaker for someone and leaving them at a hospital and then being unreachable to pick up, to kind of coordinate their care afterwards. Abduction, kind of taking somebody from one, we call them jurisdictions, from one area to another without their consent or their the person kind of conservator or durable power of attorney consent, or isolation, kind of not letting other people interact with them by screening their phone calls, screening their mails, etc. Neglect, self-neglect, financial abuse, and psychological and mental suffering. So these are all the areas that we consider, reportable to Adult Protective Services. You'll see that I highlighted self-neglect and financial abuse because those are the two I'm going to go into a little bit more detail in today. Partly because self-neglect account for about 60% of the cases that we see have some element of self-neglect. So by and large, those are the most type of reports that we see here in San Francisco. Second is financial abuse. About 30% of the cases that we see in San Francisco have an element of financial abuse, and the other ones have smaller percentages, not to minimize them, but just I wanted to focus on kind of our top two and go in more detail in the interest of time. So self-neglect. Kind of, as I already said, these are the ones where really it's a wide array of kind of how someone can be self-neglecting. They can be self-neglecting their physical self, not going to the doctor, not taking their medications, not keeping up with their grooming and hygiene, not being able to access food or water. They can also be self-neglecting their residence. They could have, hoarding or cluttering disorders or behaviors. They could have bed bugs that, they're unable to follow up to get, treated. They can be at risk of eviction for a variety of different reasons, or they can be financially self-neglecting. They are not paying their rent. They've been caught up in a scam. Therefore, their money is going to this resource instead of toward um, you know, other monthly payments that they might have. So these overall, I'd say if you pull all of our APS staff, these tend to be the most challenging APS cases, partly because we see them so often, also because they get really complex. And also sometimes these are the clients who don't really want to engage with us. We have to figure out what is that balance where we can rely on self-determination, that you have the ability to make decisions for yourself, whether they're good or bad, or do we have to kind of start to look at like maybe you don't have the ability to make that decision and go down some involuntary service planning and some other avenues. So during self-neglect cases, one of the issues that comes up sometimes, as I alluded to, is trying to look at people's decisional capacity, right? We want to see if somebody tells us no, go away, slams the door in our face. Do we take that slam the door as no, they don't consent to services, or really, they don't have the ability to really comprehend why we're here, why they're in harm's way. That we need to coordinate with their medical providers, or go out with other providers to really assess them for grave disability, etc. So as we are going out to try and engage people, in the back of our mind as well, we're always trying to think about, do they have the decisional capacity to engage in services with us or to not engage in services with us? And that kind of drives our service plan and how we're able to assist and intervene. So I will say, like I kind of alluded to in the beginning, one of the main goals of APS is to kind of investigate these allegations. So people call, your APS local office, you share your concerns. Our team then goes out to go see them in person, or does some telephone follow-up to kind of verify, yep, it seems like Miss Smith is, having some difficulty maintaining her house. And then we try working with Miss Smith if she wants to work with us, to kind of see what services we can connect them to kind of bring in those services and support, and hopefully means that abates the issue, minimizes her risk, and now she's connected to ongoing supports, socially, to have that social support or other supports to help out with the issue at bay. The most common referrals that we make are to in-home supportive services to get people linked to having a provider to help them in the home, or case management, really kind of someone after we're done with kind of the urgent or immediate issues, somebody else who can kind of continue to work with the clients that we serve to help resolve any other ongoing services, or ongoing connections that the client may need to remain safe in the community. This is the next one on here that people always say, like, I keep referring to you guys and nothing's getting done, or there's no changes, etc. So I'd say one of the biggest challenges that we have in adult protective services is this question of self-determination versus protection. So this is something that we work really closely with our workers and supervisors to really evaluate the cases that come in, to see that we're doing our due diligence to really try to investigate and see these clients and work with the collaterals already in place to communicate kind of what we're seeing, what they're seeing, follow up with their doctors, follow up with different professionals that we have access to say, should we go out with the police? Should we go out with some other care agency, other people that we know in this person's life, to really try to engage them in services? Or is our foot in the door, we'll come back again next time and try to see if we can open that door a little wider to get them in. So this is kind of, I think, one of the issues that comes up sometimes, or a lot of times in the work that we do, and also some of the frustrations with APS of some of the providers that we see in the community being like, we keep referring to you guys and we don't see that anything happens. I'll talk a little bit more about that later on, but just wanted to acknowledge that here. And clearly we do this a lot. So yeah, adults are, we do serve adults and they have the right to make poor decisions for themselves. So a lot of our work is really, people are saying no, kind of thinking about what protective factors they have in place, seeing what risk factors they have in place, seeing if they, do have the right to make poor decisions. And if not, either working with their doctors or getting a neuropsychologist to do some neuropsych testing. And really our last resort, kind of as I started with, is the most, restrictive option, which would be to file for conservatorship, where we are kind of petitioning the state to say, like, we don't think this person's able to make these decisions for themselves. We need to appoint someone to help them. So this is always our last resort that we really want to highlight, that we really have to even prove that we tried everything before we even get to submitting that application. So as I said before, financial abuse, just a little bit more about that. So just to make sure we all kind of understand financial abuse and definitions is financial abuse is the illegal or improper use of an elder or dependent adult's funds, property, or assets. This includes like cashing a check, forging a person's signature, signing documents to either put a house or assign someone as a DPOA, or kind of implementing those inappropriately. We've seen it all. This is one of the reasons why this is the second most reported allegation to us, because unfortunately, a lot of older adults or dependent adults are at high risk of being exploited financially. So our goal for these cases is to intervene, intervene to see what we can recover, and also to come up with some ongoing supports going forward so it doesn't happen again. So for financial abuse, financial institutions are for the majority of our cases, and we work with them a lot of times to kind of see what we can do to, like I said, recover funds, to either maybe bring some other people in, like a fiduciary or somebody to help manage their money, or kind of work with the financial institutions to see like kind of what's going on. We work closely with our public guardian or private conservators if needed, and have the ability with the public guardian on certain cases to really like institute this clause in their probate code to freeze the client's assets if it's an emergency case, to really stop the bleeding. This doesn't happen often. These really only happens in those OMG cases where, we know somebody's at the bank about to wire $500,000, abroad, and we know it's a scam. We've already have history. It's a scam. We want to go in and be like, let's freeze it before we can do that. So I will say this is one of those things with financial abuse cases. A lot of times, we're able to intervene soon. Some of them does take a couple tries, especially with our scam cases, which I'll talk a little bit more about next, because of the ones where I think sometimes, unfortunately, the first time somebody falls victim to a scam, they kind of get on what they call like a scam list, and they kind of continue to get targeted from different fashions. And my case example at the end kind of highlights one of those cases. I always like to go over the warning signs for financial abuse cases, because some of them are kind of, obvious, and some of them aren't so much. So one of them, if you see changes in people's, spending pattern, they've always kind of, pinched pennies, and now they're, selling out checks left and right. They're buying things that really aren't appropriate for them. Like we've seen people buy, goodness, like trying to think of a good example. They're buying eyelash extensions, out of state, right? When they're, pretty much a homebody person here and don't have any relatives out of state. That they are not, like, they're behind in all of their bills, their utilities aren't on. There's this presence of somebody new in their life that they seem to be talking about a lot, and has kind of slowly but surely infiltrated themselves into being a companion, but then starts taking over their finances slowly but surely, and or kind of starting to isolate from people that they used to be trusted, generally with the presence of somebody new or some undue influence, that now want to take some decision making financial control over someone. I also always like to kind of highlight the scams, and I wish I had, kind of a real-time one where I can do this, because scammers, unfortunately, are always like 5 steps ahead of us. It's what they're good at, and they are good at exploiting this and evolving with the times. These are kind of the main ones that we see still, are sometimes the romance scams. a new person enters their life, whether it be online or via email. The cash blessing scams, which we've seen some, still occurring recently here in San Francisco. Um, Online scams are on a rise, whether that's like those phishing emails, like, click here from, Kari spelled, uniquely at 457 at, yahoo.com. You click there and then they start to get access to your computer and are able to then look on the back end and take control of your accounts. Telephone scam, somebody calling you in the middle of the night, pretending to be a loved one, saying that you need this money right now. They kind of get you when you're disoriented, you're not able to think clearly, and you're like, of course, you jump into wanting to help mode versus stopping and thinking through like, wait, is, my loved one actually overseas or out of state, et cetera. And we've seen a lot more kind of working from home or mail fraud scams, money laundering or money mule scams, especially in our older adults. We're finding a lot of times our older adults are kind of the intermediary for money to kind of be passed through because they get a little bit of a cut. So especially our older adults who are on a fixed income, if they're making a couple $100s every month by, sure, I'll accept this money into my account and then I'll send it out, with $1,000 less. Really what they're participating in is like a money mule scam where they take a little piece of the cut. So we've been seeing that more and more with some of our seniors, and having to educate them about being part of that process and really need to stop. Okay, almost there. So I went through kind of a couple of the basic main takeaways with elder abuse or what's reportable to us, now kind of how to report it. And I'll go in the interest of time. My biggest thing that I always say, if you're not sure, please call and consult. Our biggest role on our side is the people who pick up the phone are trained MSWs and Masters of Social Work here in San Francisco who are trained to ask the questions to see if it's reportable or not. So we always encourage people to call us, and then it's our job whether to take the report or not. It's your job to have, if you have like gut feeling in your stomach is always what I say, gut feeling, call us and we can either take a report to go out and investigate, or we say like, no, it's good at this point. We're not going to take one. If this changes, this is what you might want to report back to us. The other thing kind of I said about confidentiality, if you're acting as a mandated reporter, you're somebody who works with older adults or seniors, then you are mandated to provide your name, but just know that we do hold that confidentiality. We don't disclose that to the client. If you're calling as a general member of the public, so if I, even Kari Kientzy, am calling about my neighbor I have concerns upon, I'm not acting in my role as Kari Kientzy, like, professional. I'm acting in my role as neighbor, therefore I don't have to call. And I did call, I did not have to report my name and contact information. I always encourage people to do it just because it gives us on the other side another contact to follow up to get more information and have that second ability, our worker actually working with the client, to actually ask follow-up questions to get more. So always encourage people to do it, but just know as a non-mandated reporter, you can report anonymously. So once you've made the report, I know kind of the big question I get is like, what happens then? We did our hard part of calling to make the report, but sometimes I don't hear back afterwards, or I'm not sure. So we like to highlight our main goal at Adult Protective Services is to provide advocacy services and crisis intervention to really help stabilize the situation. I've said this in different ways today, but really, our goal is we treat all the reports that we get are allegations of abuse. So we go out to investigate those to see if they're accurate or not, do a risk assessment, see, do a really, a needs assessment of the client to see what services might be needed, provide any crisis level, interventions that might need to save that client, reduce the risk in that moment, with the goal of kind of stabilizing and then referring back to the community. That's where we rely heavily on our community providers. We're fortunate to be, have a lot of wonderful community resources here in San Francisco that we refer to and help that they kind of carry the case and can act as gatekeepers in the future If things do rise up to the level it needs to be reportable again, we can step in again, help abate it, and then, pass the baton again. Um, we always like to really say we are a 24/7 program. We really go out as needed any time of day or night. Um, when you do call to report to us, just know that kind of by our state mandates, a worker will follow up within 10 calendar days, either by phone or we do unannounced visits to our clients. So just because we are, investigating allegations of abuse, we want to kind of see people in their natural habitat and not prepare for our visits. So we do conduct all of our, initial visits unannounced. So our workers go cold knock on somebody's door and try to work our way in to really, kind of assess what's going on and investigate the allegations. From there, so before I go from there, that kind of starts like the next steps, right? If the allegations are confirmed, like I said before, we really are there to like advocate for services in the community, mitigate the risk, and hopefully close our case with another gatekeeper in the community who can continue to monitor it. If the client doesn't want to work with us or engage with us here in San Francisco, or we really can't get a hold of them, we do our due diligence by trying to contact any collaterals that we have. We have different databases where we can see where they might be connected with their medical resources or other referrals that they might have open to them if they're getting home delivered meals, that we might try to work with them in partnership to see the client. We make at least 2 unannounced visits first and send a letter at the end to try to engage the client in services. But we do report back to the referring party to say we've tried our best. Do you have any other ideas of how to do it before we might have to close a case, and kind of let them know to please report back to us if you keep seeing things. Now kind of talking about San Francisco as a whole, just kind of give you an overview of us is we currently receive a little over 8,000 reports a year. I already went through those, so I'm going to skip that. Our team, we have about 53 master's levels social workers, and we have a wide range of languages that our team is able to communicate with our constituents. We are very fortunate there. We have 11 supervisors, and we're excited. We're going to have 2 MSW interns in San Francisco in the fall. So we're really excited about that. Some of the limitations that we do have in being able to serve clients is if there's no known address or location, we might not be able to see the client. We do serve people who are unhoused or might be transient in between locations, not have a stable residence. As long as we have a way to communicate, if they have a working phone or kind of a known area, then we are able to follow up with them. If all that is unknown, then there's really very little that we can do. We don't investigate allegations of abuse in skilled nursing facilities or board and care homes. We work with the ombudsman's office. And, if you do report to us, we'll cross-report to them. We work closely with the ombudsman because sometimes we do have some shared jurisdictional stuff. But just know we really focus on abuse in the community. We don't have the ability to perform 5150s, which is kind of like a hold when somebody is gravely disabled. That's sometimes a misconception that we like to demystify, that our staff is not able to, but we do rely on comprehensive crisis or SFPD or other partners who are to go out with if that's needed. And unfortunately here, APS, we don't have access to housing. As everyone knows, housing is still one of our major issues of having affordable housing. We don't have direct access to it. We work with a lot of our wonderful community providers and housing supports. Some background noise, sorry. To try to link them to Housing Navigator to apply for services, etc.
I'm in one right now. I forgot about it. It's just about elder abuse.
Sorry,
we'll try to. Sorry. Yeah, perfect. I'm almost done. Thank you. And kind of clients can refuse our services. I know I've hit this home a lot today, but I think this is one of the people's main frustrations with us is that we are voluntary. We work with the consent of the client. They are, do have the ability to consent. Then, they tell us no, we'll do our best and kind of try to like I said, leave that foot in the door. So maybe they'll want to engage with us next time. If we really do think that the client is incapacitated where they can't refuse services, whether due to dementia, grave disability, or other items, then we really explore alternative legal interventions, whether that's getting that person to the hospital on a hold, exploring, conservatorship, etc. So I've talked a lot about like what to do, but I haven't really highlighted how to make a report. So in San Francisco, the best number is the 415-355-6700. Just always help people to, can save it in your phone. We also have our 800 number, 800-814-0009. Kind of for best practice and for mandated reporters, it's best to make the report by phone as soon as possible, and you can follow it up with our written report within 2 working days. We also have for mandated reporters only, I'll put this in the chat afterwards, is we do have an online portal where you're able to submit reports online. So, if you do come across you suspect someone's being abused, neglected, or exploited, you are able to go online and make the report there. For mandated reporters, that fulfills your phone and written requirement. So it's kind of like a twofer. You can just do it online. Somebody from our intake or a social worker might call you back if they have additional questions. I highlight this is not for urgent situations though, and urgent for us is if it's physical abuse, sexual abuse, severe neglect, severe self-neglect, really if you want us to go out that day. We do check it often, but we don't want to miss those ones where really if it might need a more urgent response, like someone's suicidal, homicidal, those aren't ones to do on the portal. That's one to call us so we can take the appropriate steps if needed. Okay. So I'm going to kind of pivot a little bit more into just some like data, trends, etc. So I'd like to kind of show this just so people understand a little bit about our reporting numbers. So as I mentioned, on the January 1st, 2022, we changed our definition of elder to 60 and over. And you can kind of see in fiscal year 2021 to fiscal year 21-22, we had an intake, a little uptick, and we continue to have an uptick in reports of abuse every year. I just want you guys to highlight on this dark blue number. These are the number of new referrals that we have. Sometimes we might have an open case already on somebody, but somebody else will call it in as well. My best example is somebody goes out, a paramedic sees a client in their home, they report to us what they see, and they transport that client to the hospital. The hospital then calls us as well with the same allegations and reports to us the same thing. Then we're getting like 2 reports on the same incidents. That's what this unassigned number means. It means like we merge those reports and make it one. I know it looks weird on the graph. I just like to describe it, but this is where kind of our 8,000 reports annually come from. The unassigned reports are reports that we already had open that we're already handling with. So we kind of merged it into one to work on them. You kind of see the increase over the last 5 years. And I also like to highlight about 15% of our cases come in after hours. Our after hours program is very robust. We encourage people to call that number if needed, and you can make those reports and or talk to a social worker at any time. The other thing I like to kind of highlight is kind of our current demographics of the clients that we're seeing, because this does sometimes change over time, but if I looked at the last 5 years, there hadn't been a ton of changes. So, sorry, I was having a hard time squeezing on one slide, so apologize. I'm not the communications expert here. Oopsie. But you can see from the age perspective that we primarily are serving older adults or elders with our adult protective services. They make up a vast majority of the reports that we get every year of 60 and over. And you can see that about 70% of the clients that we serve fall under the dependent adult status. I also like to add the racial breakdown that was kind of, self-reported to us by the clients that we serve. You can see compared to the population of San Francisco, if you look at kind of how it's sliced, not by age, but just by like basic population of everyone in San Francisco. We serve African Americans higher than the number of the overall population of San Francisco, and we actually underserve the API community. And so we, again, try to target outreach efforts to work with those populations to increase report and see why we are getting less reports than come up, make up the population. We also find that 30% of our clients do live alone. So isolation and not having access to those community connections does lead to elder abuse, self-neglect, etc. And so we really try to open up those, open up a person's supports to kind of get them connected more so to people. And we look at kind of like breakdown by gender. About 49% of the clients that we serve do identify as female. 46% are just female, 46% are male, and the other percentages make up our trans population and people who are non-binary or do not want to say. So you can see it's fairly, we serve females a little bit more, but it's pretty evenly split for the clients that we serve. Also kind of just thinking about trends and kind of correlations. I like to include this slide here. Sorry if it's hard to see. I see people screening it, leaning in. I apologize. One of the things we like to show here is if you're seeing this type of abuse here, kind of outlines all the different types of abuse on the left-hand side. You can see here, these are the other types of abuse that are most to least likely to occur with it. So our social workers are trained to go out, assess for all the types of abuse that we can see. And when we do that, we see that, when somebody is being neglected, it's most likely that they're also self-neglecting. It makes some sense, right? The same thing with in isolation. If someone's being isolated, it's likely that they are also being neglected by others. Someone's being physically abused, it's highly likely that they're being emotionally abused as well. I like to highlight this too, because sometimes when you are seeing somebody, you might only be seeing one thing, but it's good to kind of screen for the other things and keep that in your mind as working professionals. So that goes into my case example, and I'm almost I'm done. So I'll give the cliff notes. Sorry, this is long. This is a case that was actually one of mine when I was a worker that I really like to highlight because it was a case that we got for self-neglect from the client's primary care physician for a client who was, in his 80s, lived alone, never married, was very active in his religious community, did have some medical complications, and he was refusing medical procedures, and also had some recent hospitalizations, excuse me, for dehydration, severe constipation, and a back fracture, but really told his doctor, I can't afford my medications, I don't have any money, and he was really confused about his finances. So it really came to us for self-neglect and not really sure somebody this provider had in her practice for many years. Money had never really been an issue, so she was a little confused what was going on. I responded, I was able to meet with the older adult, and during my first visit there, his phone must have rang 30 to 40 times in the span of 15 minutes. He recognized the number, had severe anxiety, and talking with him more, realized most of his bills were past due, couldn't pay his rent. He was literally living on Costco hot dogs. Come to find out, though, he was been the victim of repeated lottery scams, and he had lost over $300,000 in less than a year, and he was also $70,000 in debt. So I really like to highlight this where it kind of comes with us as medical self-neglect, but you can kind of see the totality, how that was really, financial abuse as well, underlying the case here. So, fortunately with this case, got to rely on his religious community. There was somebody there that he trusted that kind of was able to become his DPOA for finances, take over this client's finances, really able to take on, working with the bank, working with the scammers, really putting some safeguards in place so he wasn't targeted again from scammers, and also put somebody over his finances so he had enough to meet his basic needs and kind of get him back on track. You'll see though that this report didn't come from the bank, right? And so it's really challenging sometimes when we see this. So we're doing a lot more outreach efforts on our side to work with financial institutions to really see it's somebody who's never spent this much money, has never been in debt, never, took out a new credit card, is now $70,000 in debt for the first time in their life in their late 80s. These are some trends and changes that maybe should have been reported to us. That had a happy ending in the sense like he was fortunate he had a community that he was willing to let in for me to talk to, kind of come up with an action plan and really put some safeguards in place. So therefore he could protect himself, remain housed, and get him some supports, and be more willing to accept help from others. There's a lot of pride in himself as well from wanting to go to a senior center, take home delivered meals and utilize some of those services, but eventually over time was open to it and got to Asian Place. Kind of my last slide is just some resources I'd like to kind of highlight. I wish there's many more. I always just highlight our DAWS, our Department of Aging or Adult and Aging Services Resource Hub. Really, they do a lot of information referrals. So if you do have questions or you're looking for resources, they're a one-stop shop. Also, I know I talked about scams a little bit. I really always encourage people to report scams to local law enforcement, or they're able to report online to the IC3, because really the more that we're able to track these things kind of gets more resources and services to protect some of these victims. And there's my contact information. I'll send these slides to Juco to share elsewhere. I'm always happy to be a resource and partner and kind of ask those questions. I know the aging world is small. I want to be able to partner with you guys kind of after the presentation as well. And that is it. I will stop share. So thank you, Juco-san. Okay. And open up to like questions and discussions.
Hi, could I ask a question?
Yes, go ahead.
Vicki Johnson here. I'm very curious about your ability to freeze assets. Under what conditions? The example that you gave about the gentleman who was caught up in the lottery scam, would that have been the kind of situation where you could have frozen the assets, or does it have to be more of an exigent circumstances kind of situation? Because I see a lot of these.
For sure. No, thank you, Vicki. I will say, I wish it was, so we work with our public guardian, so it's a little bit like outside of my scope of practice, but we really, if somebody is like, it's urgent, we need to get in there now to stop them in the act, then we're able to kind of work with our public guardian. They want to, if they plan a petition for conservatorship, that they're able to kind of file under probate code 2900. I think that's, don't quote me on that one, but I'm pretty sure that's that right one where they can step in and say, like, we want to act, we want to freeze it, we're taking kind of control now to stop the bleeding. Sometimes we have this when somebody maybe is trying to sell an elder's house without their consent, or take out loans against their house, and really we know that the client's not able to do that. It's not really in the course. They can kind of, if we have enough document and evidence to show them, they can step in to do that. But they also have to plan, one of the caveats is they have to plan to file for conservatorship after the fact. Wow. And so that's part of, like, in conjunction with it, we have to kind of do a twofer. So we're fortunate that we work really closely with our public guardian's office on these cases. They don't come up often. We consult with them as well. And they also sometimes, if they can't do it, might give us some other guidance on what might be beneficial or some additional steps we could take, or like, if this, then that we can do it. So I'm not sure your role, but if you do work with your public guardian, talking to them a little bit about it might be of value.
Okay. What safeguards were you able to put in place with the situation that you just explained? Was it the Catholic community that stepped forward?
Yeah. No, I mean, with that one specifically, as I took him to the bank, met with the teller, like really, kind of closed down his accounts there, worked on making sure he was judgment proof, doing all of that. As I said, the fortunate for this case, every case is different. This one, the person in his community, Catholic community, did have a lot of assets and was a good member of their local bank, local credit union, who was willing to take on this client because he was kind of blacklisted from a lot of banks because of his bank activity. And so kind of got his money over there, added this person as the secondary person to help, kind of make sure, only Social Security comes in, we pay these bills first, this is what's left over every month. And that's kind of how we were able to do that with him, to make sure, because he had enough money to pay his monthly expenses once we cleared out the debt, which, better for worse, he was judgment proof, and we were able to help support him with that.
Thank you.
No problem.
Thank you very much for your question. For other people who have questions, please feel free to raise your hand, or you can put it in the chat as well.
Yes, and I'll share the slides and kind of thank you, Jeremy, for in the chat. I'll share the slides. You'll see that there'll be a couple more in there kind of going over some different types of abuse and neglect. So just know in the interest of time, I took those out, but you'll get the whole slide deck for your to review.
I guess while we're waiting for questions, I'll just make an observation I thought was quite fascinating. I know that for our organization, we work very closely with APS on restraining order cases. And so it was really interesting for me to see that that was just a small portion of the number of cases that come to APS. So that was fascinating to learn. Thank you.
Small but important piece, right? Because one of the few safeguards that we have for physical abuse, to put safeguards in place, are to help them want to file for permanent restraining order, or temporary and then permanent restraining order. So we really appreciate our legal resources, communities helping partner with us on those.
Do other people have questions or comments that they would like to make?
As I said, I'll put my contact in the chat. Feel free to reach out, and also I'll put the link to the report to APS for you guys to have if you don't know about it. Most, if you're not in San Francisco, but I'd say I think 50 counties in California, I think, have the ability to do online reports. So you can look at that and find your local county and see if they have that option.
I do have a quick question if we have a minute.
Yes, please go ahead.
Okay. Thanks. This is Maria from the Apilo team. So I just kind of have a follow-up. I'm on in the housing program. And so don't have a lot of contact with APS, but of course, many of our clients, that's how they come to us one way or the other, or we'll pull you guys in for usually self-neglect. My frustration comes with, I shouldn't say frustration, that's too strong. We definitely appreciate everything you do for our clients. But as we're coming in, APS has typically, say, done an investigation and determined or not determined the need for help. But then, once they have sort of made that investigation, my impression is, although I'm not clear about this, is that's kind of your role. You pass it on to some other social services agencies or legal services or whatever, and then your participation is kind of finished. Do I have that correct in terms of sort of providing the ongoing support that a lot of our clients need?
That is, and I missed your name, I apologize, but it is, I kind of try to say, we are really crisis based, right? So we try to get into a crisis, advocate for what services they might need, and then also advocate for, if they would benefit from ongoing support, what that looks like. I think in San Francisco, we do have kind of case management services in a variety of different fashions. So we try to hold those cases to make it a gentle handoff. Or a lot of our buildings have on-site social workers that we use to kind of be the gatekeepers or kind of eyes and ears, or kind of, community clinics, etc. So you know, I hear the frustration. I know we're working towards longer term case management to really make sure that we're not losing people in the cracks. That really saying like if we're getting them at this point, we put in these services, we want to have like a smooth transition, or see that through. It's kind of one of our, you know, I don't want to say goals, but it's one of the, you know, initiatives with adult protective services is to do some longer term case management to address what you are saying. So we're in the process of building that into our program as well to see like
Great.
what cases we do that, what cases is it okay to be like closed, we're good. So
Right.
you hit the nail on the head, you know, and that's something that our team likes to do too, right? Because it's hard to kind of come in and back out.
Right, right. And I'm often relied on to provide that gap, and I'm
Yeah.
happy to do that, because I mean, I have the privilege of having the flexibility in my role to kind of be that stopgap, and I'm in contact with, you know, social services agencies and public benefits agencies and all that for the client. But the number of times I've had an APS worker who said, well, we investigated and it's not, doesn't quite meet our threshold, or it does, but we handed it off to this person. And it seems like there's this kind of dip until everybody else comes on board. And yet it's not really, I'm not throwing negative on here. It's not really your role
Yeah.
to do that. That's what I'm wanting to confirm.
Yeah, the answer is like yes with a caveat, right? Like our goal is to like advocate for services, sometimes advocacy like, you know, like benefits, right? Like if it's going to take a year and a half to get them through the SSI process, that's hard for us, right? Not that there's not a need, but we might need somebody in the community to do that, or do some longer term case management with somebody who that is their role, have to be check-in and partner. You know, like the frustration is it's perfect word is here because I think it's like our team is frustrated too sometimes of like, you know, I got the client this way, I want to see it this far, but then also like
Absolutely.
to do like, you know, these other things. So it's not a perfect system. I think that's why we've the state has given us some leeway and some expectations to do some longer term case management, which our team is excited about, but it's now figuring out like what does that look like, right? Because that's what's hard. It's kind of like
and for me,
yeah.
I don't have any problem providing that stopgap, but I just wonder other folks who don't have, say, a legal issue where somebody can stop. There is nobody, and so I'm glad to hear you're working on that. Thank you so much.
No problem. Thanks for the question. I greatly appreciate it.
Thank you so much, Maria. I wanted to take this moment, you know, to portray, you know, at least for the elder and disability team, you know, our profound appreciation for all the APS workers who have helped us through the restraining order process from start to finish, including, you know, interpreting for monolingual clients. I know it's a big lift, but we've been really grateful, you know, to be able to be a team together, at least for those, you know, weeks leading up to the court hearing and shortly afterwards. So thank you. Last call, any questions that folks would like to ask?
Thank you, and to you guys for organizing this forum and this series. Greatly appreciate the opportunity. Thank you.
So I'm going to stop the recording now so that we can transition to community announcements.